Hello, my name is Dr. Margaret Yee, and I'm a family physician here at VIP Care Davenport. So the first thing I do when I come in to the office after greeting my office staff is I sit down at my computer and I turn on my desktop and my laptop. My laptop computer is what I use to see patients when I go from room to room, and my desktop is the computer that I use to do either telehealth visits and just get set up for the day. I usually turn on my ECW, which is my electronic medical record, and I want to get started with opening up my Scope platform, and I open up my Gmail. I usually start seeing my first patient about 8:30 in the morning. My staff get my patients lined up for me, which is the best thing because they have them ready for me to start seeing them. So when I start seeing a patient about 8:30, typically I'll spend about 30 minutes a patient, depending on the acuity of the problem. I usually see about 12, 13 patients a day, and we usually have time slots open every day so that we can fit in those patients that we want to see urgently or emergently. Plus, if there are any patients that went to the ER yesterday, we want to bring them in within the next 24, 48 hours so that we can help them navigate through their problem. I think the important thing to realize is that when we see patients in our clinic, that we're really paying close attention to all of their chronic diseases. Before I was doing Medicare Advantage work, my workflow was about 25 patients a day. And what's changed now that I'm working in a Medicare Advantage value-based care is that we carve out the time so that we're really spending quality time with the patient. So that's why my number of patients is less. So it's anywhere from 12 to 13 patients a day. That whole process of getting to know the patient initially is really crucial because now we can help them navigate through their health issues. You might ask me, well, how do we do that? So a lot of times my first interaction is a one-on-one conversation about where have you been with your health, where are you at now, and then how are we going to help you so that we can get better outcomes later. So some of that's going to be when I first get to see them, I want to know all of their medications. I want to go through that in fine detail. And I want to understand how are they feeling? Where are they at now? What was their past experience like with their primary care before? So that I can help them understand what I'm trying to organize for them, which is really comprehensive care. It's about saying, okay, you've got these health issues, now let's break them down and then we'll put it back together. And so some of that's going to be coming in, let's do a physical exam, let's do some blood work. All of my new patients get a full panel of blood work so I can see where they're at. And then from that, coming back into the office about 2 weeks later to go over all the results. I think what's the beautiful thing about it is after we're done that interaction, the patients know where they're at because I spend a lot of time going over it with them in detail, just understanding how your med's taken, what's the goal ultimately, and then breaking down their blood work so they understand it in their language. Through the course of the day, as I'm seeing patients, I like to keep on task with looking at Scope on a regular basis. So Scope is a platform that we use that gives us an insight into all of our patients. And the key here is to understanding if any of my patients have gone to the emergency room or were admitted to the hospital. Other things I do through the course of the day, I really want to be on top of my emails. So our Google Gmail helps us stay in touch with our colleagues, with my regional manager. We also have an internal G-chat system where we talk to each other about various things that are pertinent to taking care of patients. Usually we have a daily huddle where the team will sit together and go through what's pertinent for the day. If there's a particular patient that we're concerned about that's coming, these huddles are really important because as we know, it takes a village to take care of a patient, and it's not done in isolation. I could not do it myself. So I like to eat lunch with my team. Typically I'll bring my lunch from home, and I love, making sure I get all my food groups and making sure it's a balanced meal. So I'll bring that, I'll eat that with my team, and then after that, sometimes I'll go out for a walk around the parking lot just to get some fresh air. And then I'll typically come back and go back and look at some of my emails and look at some of my telephone encounters and do some refills. As a physician in a value-based care model, my day goes beyond seeing patients. It's about being part of a collaborative team that's dedicated to delivering the best care outcomes. I regularly participate in provider forums where I engage with fellow physicians to share insights and best practices. I also attend huddles with my regional physician coach where we review clinical strategies, discuss patient cases, and refine our approach to preventive care. Additionally, I meet with my regional manager to align on operational goals, patient engagement strategies, and overall clinic performance. What I love about working here is that I'm part of a true community of providers and support staff who are all working together to improve the health of our patients. Whether it's through mentorship, collaboration, or continuous learning, I have a network of peers and resources that help me provide the best possible care to my patients every day. So there are a lot of reasons why I work at VIP here, and I think the best way I can say it is that there's a feeling here that we are purposefully driven to take care of patients. Everyone seems to have that same philosophy. Is really for better health. And that's really what drives, I think, the clinician to be in with a group of people who are all like-minded and want the same thing at the end of the day. So as my afternoon unfolds, I usually see my last patient about 3 to 3:30, and then I use some time to just gather up my thoughts of what I need to conquer to finish my day. I sleep best if I know that I've conquered as many of the things I need to get done that day for my patients.